Mold Impacts on Human Health in Illinois, A Glance into Our Environment by Emily Dietert-Sternagel. Environmental health is defined as the science and practice of preventing human injury and illness and promoting well-being by identifying and evaluating environmental sources and hazardous agents and limiting exposures to hazardous physical, chemical, and biological agents in air, water, soil, and food that may adversely affect human health. The American Public Health Association notes that environmental health focuses on the relationship between humans and their environment. Impacts to communities of environmental issues include things such as water pollution, climate change, built environments, chemicals, inadequate water, and so on. One area of concern often overlooked when it comes to human health is exposure to mold. The following slides provide knowledge of molds, mold environments, health issues associated with mold exposure, and proper remediation and prevention. People spend most of their time in their home, school, or work. These indoor environments can expose people to indoor air pollution, allergens, structural issues, and a plethora of other health hazards, including mold exposure. Mold is a cause of concern for many individuals staying inside often, especially if they are susceptible to illness or disease. Dampness and moisture are the culprits for mold growth and development. This becomes an issue when structures remain wet for an extended period of time. When the moisture is not controlled, the environment becomes habitable for bacteria, fungi, and insects. This can become more concerning when areas that are moist are unseen, like wet insulation or leaks in the foundation. Molds can create symptoms in vulnerable populations, such as allergies, coughing, and wheezing. Some molds are considered less dangerous than others due to their inability of producing mycotoxins, which are a secondary toxin produced by various molds that cause disease in humans and animals. Exposure to molds with high levels of mycotoxins can cause a vast array of health issues, and they are a contributing factor of disease. Issues with poor indoor air quality and mold growth are distinguished as risk factors for these vulnerable populations. Populations most at risk are those in low socioeconomic strata, the elderly, infants, and children. Individuals with chronic illness, asthma, or respiratory conditions are also at risk. Exposure to pollutants and contaminants have been cited by research and clinically proven to be associated with respiratory symptoms and infections, allergies, asthma, pneumonia, blockage of nasal sinuses, bronchitis, and immunological reactions. Symptoms of mild exposure include nasal and sinus congestion, runny nose, respiratory problems such as wheezing or difficulty breathing, chest tightness, cough, throat irritation, and sneezing. Some doctors also argue elongated mold exposure can cause neurological or mental disorders such as developing a worse depression, anxiety and panic disorder, or paranoia. It is important to note the difference between mold allergies and mold poisoning. Please see your medical practitioner for tests and distinctions between the two if you begin developing symptoms you believed is caused by mold exposure. Illinois does not currently have laws addressing a property owner's duty or liability in reference to mold. Illinois does not have regulation on requirements of disclosure to prospective renters or home buyers about high mold concentrations. There are no federal laws currently in place to protect residents against mold. Under Illinois state law, lead-based paint disclosure, radon hazard disclosure, and residential real property disclosures are the only disclosures that are required. So what can you do if you are a potential homebuyer or renter? In the next few slides, we'll go over how to spot and treat mold and the different tactics that you need to be using and looking for when looking at potential new properties. In the meantime, it's also recommended to contact your local representative to help change the laws in Illinois, and also check out the links provided in the description box by the Illinois Department of Public Health. Remember, moisture is always the culprit when it comes to mold and negative health effects. Fixing the source of moisture is always the first place to begin to ensure the potential for further mold will be eliminated. Proper ventilation and proper remediation is also critical. Here are some quick and easy fixes to ensure no areas will have unwanted moisture. Fix any leaky plumbing. Check for cracks in your foundation. Regularly clean your gutters. And open your windows for ventilation when possible. The most practical way to find issues of mold is to use your eyes and nose. If you see or smell mold, you should always assume an issue exists. Be aware of musty smells in houses and apartments. Mold damage can look like discoloration or staining on walls. Keep your eyes also peeled for areas that could cause excess moisture mentioned in the previous slide. Standing water, inadequate runoff, water leaks or stains, or areas of condensation are alarming. Perform a property investigation by looking at the key elements listed on this slide. If you see any of these, be aware that mold could be an issue and could affect your health negatively. Finding mold in your home or apartment can be scary, but often it can be a DIY project. If you're going to take on the project alone, be sure to protect yourselves and others by doing the following. Protect yourself by wearing a hazmat suit, respirator, rubber gloves, and goggles. To protect others as well, do the following items when removing the mold. You want to remove furnishings and belongings from the affected area. Enclose all mold in plastic before carrying it through the home. You want to use plastic sheeting to separate the areas. Cover the air supply and return vents. Use an exhaust fan. Consider renting an air scrubber from your local cleaning company or companies dealing with mold remediation. And you want to wear a hazmat suit or immediately wash your outer layer of clothing separately from other loads. A professional company can come in and remediate the mold if the issue seems too severe or out of your comfort zone. If you live in an apartment, contact your property manager as soon as possible. If no one is complying, contact your local county officials to learn more about local ordinances and options in your area. Cleanup steps for mold go as follows. First, you want to identify and fix the moisture issue. Secondly, you want to dry completely all wet material. You then want to remove the mold growth. A description of how to do this in a step-by-step specific list will be located down in the description box below. You can also use an optional bleach treatment after the mold is removed. After the cleanup is all complete, you want to stay alert for the next few days to weeks to make sure mold is not regrowing and all moisture issues are completely fixed. Sometimes rebuilding is necessary, but you don't want to do it right away. If you need to get to this step, this will be the last step in your process, and it can be weeks to months before you rebuild. You can also bring out a professional to assess the situation to be sure that everything has been properly remediated. In summary, mold is caused by moisture. Some molds have mycotoxins, and those are harmful to humans and animals. Vulnerable populations, such as the elderly, children and infants, pets, and those with chronic illnesses, are most at risk. Negative health reactions range from mild respiratory infections to severe neurological disorders. Fixing moisture problems and proper ventilation are key. Make sure when you're looking at new properties, you use your eyes and nose and be on alert for mold or moisture issues. Protect yourself and others during cleanup. And as always, talk to medical doctors and mold removal professionals about options. Remember to check out the description box below for links to references and Illinois Department of Public Health pages. Through these links, you can find pertinent information about your residency in Illinois, your local contacts to address mold concerns, and recommendations provided by public health officials.